Um, Hi everybody, here we are at Bloom live, hoping that it doesn't rain upon us, but we're looking good so far. I'm Sarah O'Connor, I'm the CEO of the Asthma Society, and we are here courtesy of Dyson, who have a fantastic stand, as you can see behind us. Later on we will be announcing who is the winner of our Dyson competition, the winner of a Dyson Pure Cool Tower, which removes 99% of pollutants from the air. But for the time being, we're going to have a chat with Marcus to my left and Pam to my right, all about hay fever and asthma. And I'll let Marcus introduce himself.
Hello everybody, my name is Marcus Butler. I'm a lung specialist doctor in St Vincent's Hospital in Dublin. I spent a number of years in the US in New York before I took up that role, and my main interest is asthma. As well as COPD, and allergy is a huge part of asthma, and rhinitis and hay fever in particular. So that's hopefully what we're going to chat about today. And thanks for watching, anyone who's tuning in. You're very welcome to. Hopefully we'll be of some help to you today.
And Pam, would you introduce yourself as well?
Hi everyone, my name is Pam and I'm a respiratory nurse specialist in the Mater Private. My previous career was Beaumont Hospital I started, and then to Blanchardstown, and I'm now in the Mater Private. Respiratory, which encompasses asthma, hay fever, and as Marcus said, COPD and a number of other lung conditions. So it's great to be here with you all in Bloom today, so keep the questions coming.
Thanks everyone. So what we might do is maybe just talk a little bit about hay fever generally, and I suppose one of the things that people might not be familiar with was just how many people have hay fever. So 1 in 5 Irish people suffers from hay fever, and among that group, let's say about 376,000 people have both hay fever and asthma. So it's a big healthcare challenge, and it's something that affects pretty much everybody around us because it's a big group. But I might just ask Marcus to explain a little bit about the science of hay fever.
Well, I won't bore everybody to death, so just in very simple terms, hay fever is a reaction in the nose that's happening in response to tiny little particles that are airborne and lodge in the nose and induce a swelling reaction that can set off the typical symptoms of hay fever that patients will know all too well. Essentially, the nose can get runny and itchy, and sneezing episodes can happen, and nasal congestion can happen. And some people, if they have seasonal allergies, for example, not only the nose gets involved, they can get discomfort in their eyes, they can get gritty and runny, and they can also get a sensation in their palate or even in their ears of being scratchy or itchy. So it's very unpleasant, debilitating, and some people it really does interfere with their quality of life, and they seek help for it. But in terms of the science of it, it's an allergic reaction, and in fact there's probably a lot in common with the allergic reaction of asthma as well. And essentially these tiny airborne particles bind with immunoglobulins, which are these proteins that we all make, but people who have allergy make far too many of these proteins, and they set off this cascade of a reaction that leads to all the symptoms and the ailment, I guess. So that's essentially, in summary, what it is.
Thanks, Marcus. That sounds very familiar to me as a hay fever sufferer. So I suppose it's not only the cascade of symptoms, but in my case, cascade of a really miserable runny nose, feeling really lousy, crazy headaches and kind of pains in my face, and also then I suppose knock-on impact in terms of fatigue. I mean, I just used to feel so exhausted in the summer months, and I suppose it was sometimes a source of frustration that people would kind of dismiss what hay fever was and that experience, whereas actually it really made a massive difference to how I felt on a day-to-day basis. So I'm really glad we're talking about this today, and that I realise if it's 1 in 5 people in Ireland, I'm not the only person in this scenario, because when you feel like a sneezing machine, you don't really feel that great. But Pam, I might just ask you just to talk us a little bit about your experience of meeting patients who have hay fever and how they feel, what the symptoms are like.
Yeah, thanks Sarah. Particularly this time of year now when we've a huge high pollen count, and it's important, as you probably can see from the back of my clipboard, that we have our asthma, get ahead of your hay fever with our daily pollen tracker, so that people can keep an eye on the pollen tracker. It's important to know your symptoms and to know what time of year. It's like, as Marcus probably agrees, the kind of season is extending all the time, and it can be anything with our weather changing all the time, from February extending into October, and then for some people actually it's yearly. So it's important to recognise your symptoms, and it's important to go to your healthcare professionals, to go to your GP, because there are very effective treatments out there, and there are new treatments. There's sublingual immunotherapy as well for patients, and it's important if you're suitable for that sort of treatment, that you actually get your GP early and start in early, that you can go on your medication for approximately about 3 years, and then hopefully you won't probably need anything for the future. So they're all new and exciting things that are happening, and we take allergic rhinitis really seriously because we know the impact it has on people's quality of life, where they have, as Sarah said, huge headaches, runny nose, itchy eyes, and really debilitates them, and can keep them out of work. So it's important that you actually address the symptoms and to know your allergens, and possibly maybe get allergy tested as well if that's required.
Thanks, Pam. It's kind of interesting that you mentioned that idea of it being seasonal or perennial, because for me, I had it one particular summer and really was feeling particularly lousy, and it just never really went away at that point. So I would have been feeling as bad on Christmas Day as I would have been on a day that the pollen count is really high. So I guess, Marcus, is that normal? I mean, that it goes from being seasonal to being year-round?
It's a very interesting point, and the answer in short is yes, it can happen. It's not inevitable that will happen, but it often will. I mean, seasonal allergy, as we've been talking about, is mainly driven by pollen, and pollen, as Pam was saying, can start to appear early in the year. Often with trees that flower or blossom will be the first on the scene, although that's actually easing off a bit now. And then the grasses take over, and there's a lot of grass pollen circulating in the air. And then weeds as well, particularly even into the autumn, that can be a problem. Common Irish weeds like nettle and dockleaf. So those are, as well as fungal spores that get released in this time of year, are the main factors that cause the seasonal allergy. Perennial allergy, or all year round allergy, then, is generally speaking allergens that make it into the home and stay in the home, and that's mostly driven by the house dust mite, this microscopic awful thing that inhabits everywhere humans inhabit, and particularly heavily found in bedrooms. And there's measures that we could talk about that can help to lessen that somewhat. But also you can have your pets at home in the house. They bring in allergens that will sit around all day long, all year round, on upholstered surfaces and can cause trouble.
Thanks, Marcus. That's really interesting. So we have some questions coming in, and we'll bring those to you in due course, because we have a few topics that are kind of relevant. But I suppose one of the things that I'd love to know about is that link between asthma and hay fever, because you've kind of touched on it very briefly there, Marcus. But I guess I'm interested to know, like, scientifically, why is that the case? Why is it the case that 80% of people who have asthma also have hay fever?
Again, very interesting question. I mean, most experts in this area and world organisations that deal with asthma, allergy and rhinitis, hay fever, now believe that they're both manifestations of the one spectrum, at two ends of the one scale, if you like. And in fact, when we look back over the historical records, allergic rhinitis started to appear first on the scene as an increasing problem in the Western world, and that was evident as early as the late 1800s, and then reports escalated through the early 19th century. But then in the latter half of the 20th century, in some 1960 onwards, in fact, asthma rates started to noticeably rise in Western countries, and there's a very strong link, we now think, between the two. This is the one airway theory that I've mentioned already, where essentially the lining of the nose and the lining of our windpipes have a lot in common. They have a lot of differences too, but they have quite a lot in common, which certainly where allergy is concerned seems to account for the one surface reacting in much the same way, be it in the nose or in the lungs. But that said, allergic rhinitis or hay fever is much more common. As we said, estimates vary between 10 to 30% of the world's population in the Western world, I'm talking about, seem to be affected by this. So about 20% or 1 in 5 get hay fever. And maybe about it's 1.5 times to twice as common as asthma. So asthma is therefore also an incredibly common problem, but not quite as common as rhinitis. And it's important to recognise both. And hay fever is a risk factor for subsequent rhinitis. If somebody's diagnosed with allergic rhinitis, hay fever, unfortunately there's probably a 3 times increased risk of asthma in their lifetime than in somebody who doesn't have rhinitis, which is runny nose of hay fever.
That's really interesting. Pam, do you see people picking up on the idea that, like, hay fever is a serious thing and that it can have a knock-on effect, or are people just inclined to put up with it?
Well, I think maybe when they start to get symptoms first and they're mild, people are they are inclined to, go to their pharmacist, start and be a bit ad hoc about taking their medication. But when it starts to really impact, and the headaches start, and they have constant, and it starts to impact on their life, that it's affecting work and their whole quality of life, then they take it seriously. So you will see, and the GPs and ourselves around the country see a huge increase of people coming to see us. So it's really important, as Mark said, to know what your allergens are, to know, to treat the symptoms, and to constantly be in contact with your healthcare professionals about it. Yeah.
So one of the questions we've had in is from Ursula. Thanks a million, Ursula. Ursula asked, what's the best way of helping people or someone who has asthma and who has hay fever? So, Marcus, do you have any kind of general hints and tips, and we can talk about the kind of more medical kind of treatment stuff after?
Thanks. Well, from the hints point of view, I guess the main thing that's practical for everybody is just being aware of whether there's a link to an allergy in my own case. If I have asthma and I've hay fever, is there something that sets it off? So typically, if you find that you're only affected by these symptoms around this time of the year and when the weather is better, that should set off suspicion for hay fever. Asthma, of course, with chestiness happening, and oftentimes our colds going to the chest. Is there a variability in your chestiness tendency that seems to greatly improve and then greatly worsen at times, only to greatly improve again? Reduction in allergy is a key thing, and you can do that by closing windows and doors, for example, when it's breezy and on hot days. A lot of these allergens are airborne at that time. It's also, if possible, to keep animals out of the house. Your pets, if you can have a beloved pet that has a spot outside rather than indoors, that's preferable. Of course, not always so practical. And keeping allergy down with allergy impermeable covers on bedding is good for the house dust mite scenario. None of these will cure or eradicate the disease, is important. But they are helpful. But if it becomes more intrusive in your life, it does really need medication to supplement those approaches.
So for me, as somebody who has hay fever, some of the things that have made a big difference to me are things as basic as, keeping your bedroom window closed at night. You think you're aerating it, you think you're doing the right thing, but actually you're letting the pollen in at the time of the day when the pollen count is highest. So that's made a big difference to me. Things like not drying your clothes outside when the pollen count is high, and using any excuse to avoid cutting the grass is a simple positive benefit for my life, but also means that my hay fever is a little bit more in control. So I think those are kind of helpful pieces. And one of the other tips that somebody had told me is about putting a little bit of Vaseline around your nose, which makes a big difference because it's kind of sticky and it captures the pollen, or some of it at least, on its way into the airways. So those, I suppose, are helpful points for people. But really, we're very keen that people keep their hay fever and their asthma in control. One of the things can be really beneficial is if people give our advice line a call. So that's on 1-800 44 54 64. And we have specialist nurses there. We phone you back. We make an appointment at a time that suits you. They can run through your hay fever, how to minimise it and how to make sure it doesn't impact negatively on your asthma. But Pam, I just wonder, would you explain to people a little bit about the pollen tracker and why it's useful for people to know about the pollen count specifically? I mean, what difference that can make?
Yeah, well, it's especially for if you're planning a day or weekend that daily, what the pollen count is going to be like. And it's like even basic things like the news and keeping an eye on that. They're now, we'll talk in the weather about whether there's a high pollen count and keep out indoors today. Another tip as well then for the house would be as well, reduce carpets, try, damp dusting. All those, and they seem like small things, but they do make a huge difference. And as Marcus did say there, we're never going to completely eradicate the house dust mite, but all those are helpful. And you'll find, especially with kids and with your small kids, if they're very, very symptomatic, and for yourself, different things like try not to get change in the same room, and an awful lot of our patients come to us with saying that their triggers are sometimes the cleaning products, that they can really spark an asthma attack or an allergic rhinitis, because some of these cleaning products are highly chemical. So it's really important, and all these tips are on our asthma website, that you can pick them up, as well as the pollen tracker. And then if you have any concerns, ring our advice line, as you just said.
Thanks, ma'am. Sorry about that. I'm looking up and down here to make sure that I have your questions. So Elizabeth had a question there about whether there's a good nasal spray that she can get over the counter. And actually that's kind of timely, because we're just going to have a chat about the actual medical treatments and what a difference that they can make. Marcus, would you tell us a little bit about what options are out there in terms of what kind of treatments people can get? I know Pam mentioned one earlier, but just to give us the kind of, the explanation.
Yeah. Well, maybe one of the important things to say is what not to use. And over-the-counter, one item that's widely sold that I'd exercise great caution with if you've hay fever is decongestants. So the type of product like Sudafed, Atrovine, these are helpful just for very brief, transient, hardly there all year symptoms that you rarely get. And as long as you take them for 1 or 2 days, that's probably okay. But when you start using those on a regular basis to deal with actual hay fever that can go on for months and months, you can make a bad situation worse and end up needing to keep using it because of developing a new disease called rhinitis medicamentosa, which is a mouthful. But it's essentially the medicine itself is begetting more swelling, and it's very important not to use that long term. What is helpful to use over the counter would be saline. So something as simple as Sterimar, for example, you spray moist saline into your nose, and that's helpful to clean your nose a couple of times a day, and especially if you've been out gardening or exposed to allergy that you don't usually get on well with. It's good to wash it away with saline. People who are more affected can use actual full-on nasal sinus irrigation, which is a product called Neilmed, that again is over the counter, and you make it up at home and you pour it into your nostril, and it really cleans thoroughly and reduces mucus and particles of pollen. And then antihistamine is probably the next thing that could be considered if some people would be able to get that over the counter on holidays, for example. Those are useful to an extent. Drugs like Zyrtec and Telfast and Claritin are prescription antihistamines here that are better because they're less sedating. And histamine is one of these particles that gets released from the nose of an a hay fever sufferer in response to the allergen. It triggers the release of this compound called histamine. So the antihistamine helps to mop some of that up, and it negates some of the effects to an extent. But in fact, for most patients who have troublesome bad hay fever, enough to seek out help from a doctor, the worldwide recommended number one medicine for this would be an intranasal steroid spray in the nasal form, because it minimizes hugely any risk of damage from steroid, which is negligibly small when you use it in your nose compared to having to take tablet steroids, for example, for a full-on flare-up of asthma, or people who have diseases where they chronically have to take asthma tablets, steroid tablets every day. They run into far more significant side effects from steroid. So steroid can get a bad name, but intranasal steroid is good. In fact, inhaled steroid for asthma is also the leading treatment for asthma, recommended by experts worldwide.
That's great, and I think actually we may have answered Emily's question about over-the-counter products there, which is great. Maybe, Pam, you might just explain to us, I mean, I suppose lots of people, as I mentioned, kind of put up with their hay fever symptoms, and they kind of put up with feeling lousy. But what difference can a review make to somebody? I mean, going to their GP, their pharmacist, or their asthma specialist nurse?
Well, even the simple thing that we assess is we just go through their symptoms with them and, try and pinpoint, like, treat their symptoms, treat the patient, treat the story. So, just a review, even ringing our advice line to, give us your symptoms, and they're small tips, but they can make a huge difference to patients. Like Marcus just said, then the nasal sprays, and instead of jumping straight with the antihistamines, like a lot of the time, and an awful lot of our patients that come find that the Neilmed, the nasal wash, is really, really effective. It's not very pleasant, and people, especially young adults, don't really like doing it, but they're doing it in the privacy of their own home. So it really, really is effective. So it's important. And the tips that you just mentioned earlier, using Vaseline around your nose, your wraparound sunglasses, and avoid, know your garden. And, as we're here at Bloom today with the plants, and the certain plants that will admit, the larger spores and the ones that you're actually allergic to, it's important that you know this, and what to avoid and what not to avoid. So a simple review, which could only take a few minutes, can make a massive difference to your life.
Thanks, Pam. So I might just actually direct, based on Pam's point, everybody to have a look on our website to see our special Gardening with Asthma and Hay Fever booklet. And it's great, actually. It's really well designed. We really like our designer. But it's very clever because it talks about the kind of plants that are better to plant, because they don't have as high a pollen count and they won't impact on people as much. We've general hints and tips about how to make sure that you're gardening so that actually you're not bringing all of the pollen inside. And one of the points that people make as well is that actually having an air purifier can make a big difference to people, which is useful because we're here with Dyson. And just to remind you, we'll be announcing the winner of the Dyson competition at the end of the broadcast. So keep tuned in and we'll let you know who is the winner of the Pure Cool Tower. But maybe what I might do is, Marcus, we did have a question here from Caroline. So she said she's on Seretide 500 and Dymista, and she's just wondering what's the best thing to help her with her hay fever.
Okay, so that's an interesting question from Caroline. Seretide is treating her asthma, and I can tell from what she's on that it's quite significant asthma to be needing Seretide, and it's important to take that every day, twice a day in fact, to get a good result with it, even when your asthma is seemingly gone. A common mistake, understandably, made by patients who want to minimise their exposure to medicines is that they skip their inhaler when they're well, and that's counterproductive. It tends to work the opposite way and make the asthma more likely to recur. Dimist is an excellent choice of medicine. It's a combination spray that has antihistamine coupled with the all-important steroid for nasal symptoms of hay fever, and it will help significantly to use it, but it'll help even more if you actually clean the nostrils, just as we've been banging on about with nasal saline, because nasal saline makes such a difference, not just on its own, but also to improve the response you get from intranasal medicines. And all experts worldwide in hay fever would recommend the use of saline before you administer your prescription spray into your nose. And I think that helps.
Thanks, that's great. One topic that people are always really interested in is about hay fever and asthma in children. So I don't know, Pam, are there any, I suppose, special things that we could do to help parents maybe figure out that their kid has a hay fever and asthma problem, or is there anything special about hay fever in children we should know about?
Well, with hay fever and asthma, as we talked about earlier, they go kind of hand in hand in 80%, I think Mark said, of patients. So particularly with children, they're the first things that parents usually notice. And a lot of the time with the runny nose, constant runny nose and watery eyes, and they may notice like a little nasal crease there, especially in kids. So it's really important you bring the child to the GP, to try and treat those symptoms, because it is a huge impact on children, on their sport, on everything they do. As I said, their attendance at school, running into the older age group and young teens for exams, particularly around this time of year now, we've our Leaving Certain Junior starts coming up, to try and keep the windows closed, as we just talked about earlier, and treat the symptoms before, because it is a huge tiring effect, as you just said. It really wipes energy, so it does affect study, it affects everything, so it's important that they recognise the symptoms and treat.
I might just flag to somebody when we're talking about children asthma and hay fever, people can phone into our advice line on 1-800 44 54 64, and that's actually really quite useful in terms of we'll talk you through any particular experience that your kid is having. We can give some people some advice about how to make sure that you're taking your inhaler and your medication properly, and also guide you in terms of if it is the case that you need to bring your child to the doctor, and what kind of questions to ask, and how to be equipped with the knowledge that you need to make sure that they're feeling well. I mean, on average, children with asthma miss 12 days of school a year, which is really substantial, and not to mention the sports piece, as Pam mentions, which is lousy because nobody wants to stand on the sideline feeling like they can't join in. But I might just ask Marcus to kind of briefly explain to us this idea about the hygiene hypothesis, because of course people always ask where is asthma coming from and why is it growing, and that might help people understand.
Yeah, that's a very good question. Just before I forget to just say that Pam said an important thing about in kids who have rhinitis, they're not going to tell you that they have an itchy nose, for example, but the giveaway, as Pam has mentioned, they may have a little crease across the top of their nose. It's because they're constantly rubbing their nose, maybe when you're not seeing it, and that's a giveaway in a child, as well as the runniness and the secretions. And the giveaway symptoms for asthma in a child is because cough that keeps coming back, which is oftentimes not pieced together as being asthma by a parent who thinks that asthma is only wheeze. And wheeze is again the whistly sound you hear when you're breathing out. In more severe or significant cases, you can even be wheezy when the child is breathing in and out. But certainly when they're breathing out or exhaling, you'll hear that whistly sound. The hygiene hypothesis is a hypothesis, which means that we don't know for sure. But there's certainly some evidence that's more strongly in favour of the arguments than against the argument that this happens. And in a nutshell, the hygiene hypothesis is that the cleaner lifestyles that Western civilization has brought into play, and cleaner manufacturing and cleaner living standards, working places, has probably done something at an immune level that makes us more predisposed to develop immune disorders as mild as hay fever and as severe as life-threatening asthma in the rare cases that can happen. So it's an important area for study. There's vast amounts of science going into this, but it's all confounded by other factors that make it hard to interpret the data. But essentially, for example, rates of asthma and allergy are a little bit higher in those who are in urban living compared to rural living, a little bit higher in those who work in industrial type jobs compared to those who work in farming jobs. The rates are a little bit higher in young children who get into creche or secondary, or sorry, into creches at an older age than at a younger age. All due to the fact that dirt is being brought into play sooner in somebody's life who doesn't get allergy, and dirt is coming into the life of somebody later in life where they are getting allergy. So hygiene isn't always good for you, perhaps, is the message that comes out of that. But it is still hypothetical. There are arguments I could give you against it also.
Well, that's good. So I don't have to feel bad about the fact that my room is a mess at the moment. That's actually helping me. It's a positive.
Except for the dust.
Oh, sugar. Okay. Well, I guess you can't win every single way. So I mentioned again about if people are interested on the gardening level. So we do have 2 leaflets. One just kind of tells people some general information about gardening, and the second one, general information about hay fever, and the second which tells people all about gardening. And those are both available on our website. So you'll find it on the homepage, and it'll be there as a kind of a splash for the next week. So feel free to have a look on asthma.ie. But the other place you'll find it in general is in the lifestyle section. And we also have stuff, as Pam mentioned, about exams. So we have information there for anyone who has exams coming up, and also holidays. But I might actually ask that, because I'm sure that's something that people are interested to know. Like, what can you do to make sure that you don't have a major escalation of your hay fever and of your asthma while you're on holidays? Marcus, any thoughts?
So if you have particularly troublesome hay fever or asthma, it's really important that your medicines come with you wherever you go. And the general factors that we talked about already are sensible, such as keeping windows and doors closed in wherever you're staying, where possible. It's also important to remember that sometimes or sometimes symptoms of asthma and hay fever are set off actually not by allergy but by viruses that you pick up in the to and fro of getting to and from another country, and it can cloud the picture as to whether it's truly allergy driving this or the virus you picked up on the way. So it's also helpful to know that if you think you've been exposed to a lot of allergens, try and change your clothes when you get inside, not to have the allergy building up inside the pollen or whatever, and also potentially have a shower just to help get rid of it from your hair and your skin. That's if it's really problematic enough to make you want to do that.
Thanks, that's really useful. And as a regular festival goer, not only at Bloom here today, but also at music festivals, I've often really tried to be thinking in advance, like, what can I do to make sure that not only am I enjoying the music, but I'm enjoying the festival experience at things like Electric Picnic or Independence, like I'm going to this year. Pam, any thoughts, anything extra people can do on that level?
Well, the thing there that Margaret said was bring your medication. Another thing was to make sure, especially if you're asthmatic, that you always bring your reliever with you. And you all know the 5-step rule, and that is the 5 steps that you can take. Being an adult, you try and sit down. If you get a severe asthmatic attack, a severe shortness of breath where you can't breathe, you have your blue reliever inhaler. It's usually blue. Bring it with you, and in that instance, you can take 10 puffs within 10 minutes. Try not get anybody to lie you down, stay away. Get help, number one, if you can, if there's somebody with you, but always bring your blue inhaler with you. Another tip would be, you have to, we have pharmacy days ourselves that myself and my colleagues, other nurse specialists all around the country, that actually you can come and see us, and it's free, that you can come and we can check the basic thing of your inhaler techniques, because an awful lot of people have never been shown how to use their inhaler, and when we go to look at them, they're not getting it. They're not even getting half their medication, so they're not controlled, and that's why they're not controlled. So it's really important that you come and see us. That, like, we have an onus as healthcare professionals that we should check your inhaler technique on every visit, but that's not always possible. So try and get to our clinics. Try and and all this information is available on our website. And then, particularly as we mentioned earlier on about with schools, I know this isn't a festival really, but we have a great youth schools program with the Asthma Society run, that the schools can get in contact and that we can come out and do an education talk with yourselves, with the teachers and with pupils, and to set up an asthma friendly school. And that's really, really important that we do that. So the message is always bring your medication with you. Try and know what your triggers are, and if you have your blue reliever with you, it'll save your life.
Thanks, Pam. So that's great. Pam mentioned something that's really important, which is the 5-step rule, and we are evangelical about making sure that every single person knows what the 5-step rule is. If you go to our website, we've got 2 videos, one which has the 5-step rule for a child under 6, and the second, the 5-step rule for a child over 6. And you can also give us a call on 1-800 44 54 64, and we'll post out to you a small little wallet card of the asthma attack card, and it's brilliant because it has all of the information about the 5-step rule on it. It has the kind of info that you might need to have on your fridge or on the fridge of your kid's minder or your grandparents, to make sure that everybody's fully briefed. And as Pam mentioned, obviously we run pharmacy clinics, so if you want, give us a call and we'll arrange to come to a pharmacy near you, or if you're running a pharmacy or you're involved in one, pop into them and ask them to get in touch with us. We provide that to the pharmacy. It's free of charge for the customer to come in, and you get a really good refresher on everything you need to know about your asthma or the asthma that you need to do for somebody that you're looking after. And as Pam mentioned, we are going to be Oh, sorry, we've got a great question here from Shelley, which is, do people grow out of asthma? So I think we'll take this as the last question, and then we will announce the winner of our Dyson Cool Tower. But Marcus, would you be able to explain that? Do children grow out of asthma?
So the answer is they certainly can, and I mean you didn't need me to tell you that probably, because everybody knows people who have grown out of asthma. The science of studying this is again thwarted with problems, because you have to follow up people essentially for decades to know how permanently their asthma goes away for, and there's a strong suspicion with a fair bit of circumstantial data to support it that a lot of people who have childhood asthma later in life can have a return of their asthma. It's very hard to say who that will happen to. It probably is more likely to happen to those who have more severe asthma. But there's certainly every chance that it can grow out. Unfortunately, at this point, we do not have any treatment that conclusively stops asthma returning in adulthood. There's some controversy in the area at the moment. Maybe there is some weak data that, for example, exposing somebody over a 3-year period to the daily tiny amount of allergen that they normally react to, which is called immunotherapy, can help to minimise the hay fever from getting worse. And if we believe in the hypothesis that hay fever will result in asthma, possibly that can help prevent asthma. But the jury is still out on how conclusive that is, and it's not a strong effect. Asthma is not curable when it does come around, but the good news for any asthma sufferer is that they really shouldn't have asthma symptoms with good treatment. If they take their treatment daily, they can have a totally normal quality of life. And remember that there are Olympic gold medalists running around and cycling and going up mountains who have daily medicine for their asthma but are world beaters, who have no symptoms whatsoever and are superhuman. So there's no reason why it should get in the way as long as you recognise it, get it diagnosed and treated correctly.
So that's inspiring. So I'm going to aim to be one of the superhumans, keeping my asthma in control. Can I just announce that we're delighted to say that our winner for the May Dyson Pure Cool Tower is Dolores O'Brien. Dolores, congrats. We'll be in touch with you in the course of the next few days to make sure that you get your Cool Tower or your Pure Cool Tower out in the post. Can I just say a quick thank you to Dyson, who are right behind us here at Bloom. They've given us a hand and made sure that we can be here, and they've made us very welcome. And can I also say thanks to Marcus and to Pam for joining me today to have a chat about hay fever and asthma and how that works. If anybody has any follow-up questions, feel free to pop them onto us on Facebook, and we'll be in touch, and we'll make sure that we get the expert info if anybody has anything that has just occurred to them that they want to ask. But thanks for joining us, and have a lovely Saturday. Bye.